Good afternoon, dear friends. This is Natalia with you on the Doctor Online channel, where I share my personal experience and answer your questions. The interaction between osteochondrosis and blood pressure is a topic that hasn't been fully studied yet, but their relationship is obvious. For effective treatment of high blood pressure, some scientists are trying to classify cervical hypertension as a separate disease. In this video, I will allow myself to use this term more than once. A doctor's approach to hypertension is quite predictable. The treatment of high blood pressure begins with selecting antihypertensive medications. However, in a number of cases, we do not observe the desired effect from prescribing traditional medication therapy regimens. Why, right? First of all, because many of them do not actually affect the main cause of cervical hypertension. Any injury, age-related changes, or a certain lifestyle can trigger the development of osteochondrosis. When the muscles spasm, the nutrition of the intervertebral discs is disrupted, which in turn leads to compression of the vertebral arteries. They become pinched, blood circulation is impaired, and the tissues do not receive enough oxygen. Over time, the blood vessels become deformed, forming bends that further complicate the already impaired blood flow caused by osteochondrosis. At the same time, microcirculation is also disrupted, which certainly contributes to increased blood viscosity. The nourishment of brain tissues is impaired, including the structures responsible for regulating blood pressure. In this situation, the lack of oxygen stimulates impulses from the brain and spinal cord, which promote the release of adrenaline, and this in turn also increases blood pressure. Taking all of the above into account, it can be concluded that in order to treat cervical hypertension, it is necessary first of all to eliminate muscle spasms, reduce increased blood viscosity, and stabilize blood flow in the brain tissues. But how can you tell if cervical osteochondrosis is the cause of high blood pressure? You may experience headaches accompanied by dizziness, nausea, darkening of vision, and seeing floaters before your eyes. There may also be pain and stiffness in the upper chest and neck, a feeling of numbness, and in some cases, loss of sensation in the hands and numbness at the tip of the tongue. Yeah. How dangerous is the combination of hypertension and osteochondrosis for each of us? First of all, the risk of transient cerebral circulation disorders and strokes increases. How can we establish a connection between the development of hypertension and cervical osteochondrosis? By performing an ultrasound examination with a Doppler study of the vertebral arteries, X-ray imaging of the cervical spine, and magnetic resonance imaging of the head and neck, how should so-called cervical hypertension be treated? Many of us, of course, know that non-steroidal anti-inflammatory drugs are used to treat osteochondrosis. However, their use unfortunately leads to the opposite effect: spikes in blood pressure, which is primarily directly related to fluid retention in our body. In addition, spinal massage and various physiotherapy procedures, which we often use to treat osteochondrosis, also provoke spikes in blood pressure. So what should be done in this situation? You can turn to muscle relaxants for help. They are quite effective at relieving muscle spasms in various types of dorsopathies, and at the same time, they help lower blood pressure. For hypertension associated with osteochondrosis, a combination of an angiotensin-converting enzyme inhibitor and amlodipine is successfully used. Special attention in this situation should also be given to the medication Cavitron, which combines three important effects: vasodilation, antiplatelet action. In other words, it prevents platelets from sticking together, and anti-hypoxic effects, which help reduce the oxygen needs of the organs and tissues in our body. With cervical hypertension, you can periodically use a Schanz collar. It compensates for the stress placed on the cervical spine, thereby minimizing the risks of further spikes in blood pressure. Therapeutic exercise also plays an important role in the treatment of hypertension caused by osteochondrosis. It's better to have the first sessions in this case under the supervision of a physical therapy instructor. As for manual therapy, it really works. However, you should only trust a professional with extensive experience in treating various types of dorsopathies. Dear friends, hypertension caused by osteochondrosis, as you can see, is not a sentence, but a call to action. This was Dr. Savkina with you. Subscribe to my channel and stay healthy.